Aloha, good morning, everyone. Thank you so much for being here on this Thursday. Welcome to the COVID-19 Care Conversation with Ryan Kalei-Suji and me, Yanji Denise. We are so happy to have you here this morning. This, of course, is a conversation brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. And Ryan, we have another very special guest today.
That's right. Joining us this morning will be Senator Ron Kouchi from the island of Kauai. He, of course, was involved yesterday in a big press conference that was announced as the state reopens to outside visitors. We're going to be talking to him more about that, as well as the legislature, which is currently in session, some of the plans, proposals that we are hearing, and ways in which lawmakers are finding ways to support residents during this time. So looking forward to talking to him. We, of course, want to encourage all of you watching to please enter your questions that you may have for the Senate President, and we'll get to as many as we can. There's a number of different topics that we want to cover and a lot of questions that we have, obviously, so we will try to get to as many as we can. We also want to, of course, first thank our sponsors at the Hawaii Executive Collaborative and Hawaii Pacific Health for making this conversation possible.
We always like to start with the count. And yesterday, unfortunately, after 2 days of single digits, we are back into the double digits again. 16 new cases reported for a total of 835 positives since the pandemic began here in the islands. Good news, while we have seen a spike, we are not seeing the level of cases that occurred during the peak of the pandemic wave here in Hawaii. Over 71,000 tests have been conducted in the state so far. 1.2% have been positives, and we have not seen any new deaths since the beginning of May. So, we sort of temper those double digits with, keeping a broader perspective of the good things we still have here in Hawaii.
That's right. And also, of course, we always remind people to a key number that we would always track as well during the time of the height of this here in Hawaii was those hospitalizations. And that's sort of the number that officials continue to look out for is the amount of availability for hospital beds in those ICU units, as well as ventilators. So we continue to track those numbers. And again, we'll get an update on today's numbers a little bit later. But for now, of course, we would like to bring in the Senate President, who is joining us here now, live from the Hawaii State Capitol. Good morning, Senator. Great to see you. First, want to, of course, talk about some of the headlines that were made, obviously, yesterday in the big announcement of Hawaii's new lifting of the 14-day quarantine for those who would like to enter the state if they were able to get tested. What was some of your thoughts into the process that went into making this decision with all of you that were there yesterday?
Well, I think first, Ryan, what I really appreciate is what you said at the very end of the lead-in. A lot of the reporters and a lot of the constituents simply ask, at what number of positive tests would you make a decision to ramp something down? And it's not just a linear question where a single number is the indicator as to having to take a different course of action. It is a multi-layered assessment that includes exactly what you said, the hospital beds, ICU units, ventilators available. And in this particular case, Hawaii has been very fortunate in our low rate of hospitalization and one of the lowest, if not lowest, mortality rates in the country. And so even if there's a larger amount of positives, but they are mild symptoms and they are able to isolate for the 14-day period until they become negative again, that's a whole different number than a small number of positives, but all of them would have required hospitalization. So it's, a little more complicated than that in looking at it. The other thing is that there are details that need to be worked out, but for the airlines to start booking, for the hotels to start doing the cleaning and preparing, redesign of dining rooms and front desk and everything else to get proper health and safety procedures in for the guests and the employees, they need some lead time to prepare. As an example, while we're trying to work with CVS, who has 1,200 stores throughout the country, they don't have stores in Washington State. Washington State is one of our leading areas where visitors come from. So in this ensuing period before August 1st, we certainly need to find a way to have testing available. I know Lieutenant Governor Green, who has been leading this effort with Dr. Mark Mugaishi, are exploring other providers. And so that would be something that we would be looking at. I know the COVID-19 committee has been talking to the local labs here, and it is certainly hoped at some point we would have adequate supplies and testing material so that we could have some of the testing activity occur here, have some of that business stay in Hawaii, but we're not going to have testing operations stood up here if it compromises the ability of having adequate testing available to the residents of Hawaii.
So for a market like Washington, what you're talking about, people coming in from Seattle, let's say, is the point now, in the next month or so to identify a pharmacy that you think is credible? I mean, my question with all of this, with CVS testing or whomever it is, how do we ensure that those documents aren't forged? Or who are they sent to? Are they sent to someone at the state?
We're hoping that it gets to the part where it's digitized and gets to the Department of Health, but some of the pharmacies they're talking to would be Costco, who has pharmacies, and they're based in Kirkland, Washington, Walgreens, Kaiser. So these would all be names that we recognize, and but they would also have to have testing materials and capability to allow this for travel. Most areas still have protocols in place where you need to have your doctor's prescription, you need to have some kind of symptoms, so we'll need to have an agreement that there's adequate supplies for this to happen. I am aware in Los Angeles at Dodger Stadium in the parking lot, for example, they are doing more robust testing and having drive up and free testing available. So there are some areas where they are making testing available where you may not have to purchase it. Right now, it seems the price point is $140 for the test on the mainland, and that would be costs borne by the traveler. At this point, we're not anticipating that we're using any of our money to have the test discounted in any way.
And we're talking about domestic travel with the United States, but what about for those countries and for those foreign visitors who also pay a large part of our visitor numbers, like Japan and the Asian countries? How would that sort of documentation work with maybe some of those countries as well, seeing that they don't have maybe the access to a CVS or some of the pharmacies that you mentioned?
No, the specificity of Japan, South Korea, New Zealand, Australia, and other South Pacific nations who had the ability to close their airports all have low rates of infection or transmission like Hawaii. So that's where the discussion of the travel bubbles come into play. And for them, because our rates are similar and low infection, then there would be a reciprocal agreement of travel. What's complicated, though, is that while we would be interested in doing that with Australia and New Zealand, I believe Australia is not taking any foreign visitors until January of 2021. And if that affects New Zealand, even if we had an interest, there aren't going to be international planes flying in there. So it would be difficult to get visitors in. Japan has a restriction on U.S. travelers because of the high rate of infection occurring on the continental United States, and we are part of the United States. Is there an ability for a carve out? And if there isn't, then they're not allowing that U.S. travel to occur. And again, on the international side, it makes it complicated, but it is easier for us to put mandates on foreign visitors coming in. They're not U.S. citizens. I've gotten some emails already that what we've laid out is not adequate. You need to demand from your local and state elected officials that they make this mandatory. We cannot make this mandatory. The state and county governments don't have that ability. It is a federally regulated issue. We can put the quarantine in to try and encourage that you take the test instead so we can get the information, but there isn't a legal authority to mandate that you get the test before you come.
I want to bring in two comments here because they really encompass the debate. First is Ingrid Peterson. She says, our numbers are good, but the mainlands aren't, and we're letting in those travelers while hospital numbers are surging there. On the flip side, right above her, you have Patty Brazil Benson, who says the virus isn't going to magically go away. So pre-testing is a way to get visitors back to the islands. Can't keep everything shut down for the next 6 months and waiting for a vaccine. So got to move forward. I think, the comments from these two viewers really shows the debate that's happening here in Hawaii. How do you feel about reassuring people that it will be safe once we start to let these visitors come in? Because a lot of these Western states that tend to be the bread and butter for the Hawaii domestic travel market are seeing some pretty high numbers, and it is alarming for many people.
Well, at this point, it's been said by several others, there is no silver bullet or 100% guarantee that we could put protocols that we can put in place to allow this travel to occur. The difficulty is on July 31st, the federal $600 a week unemployment insurance plus up ends. And so it's a real difficult situation with people who are going to be going off the economic cliff starting on August 1st. And how, on the flip side, how are we ensuring the health? And so, what I said yesterday at the press conference is, for those who are going to participate in the pre-test program, that reduces by a certain percentage the risk that's involved. The thermal scanners, while they can't catch the asymptomatics, they catch a certain amount, and that reduces risk by so much. To have better tracking available, some of the health questions on the form that you need to fill out to come in reduces that layer by so many. By next month, we will have 300 contact tracers stood up. And most recently, with the last hotspot in Waipahu on Oahu, the Department of Health had contact tracers literally going door to door like they were campaigning, following up with close contacts of the churches. When we had that hotspot identified on Kauai at the end of last week, by Sunday, they had tested almost 100 people. There was another church on Kauai that was involved and a large family. And so we're hoping that we're showing that we didn't have that many contact tracers available early on. We didn't have test kits that worked at all initially from the CDC. Now we've got test kits that work. Now we have more testing available. And then outside of the DOH lab, which was limited initially, all of our tests had to be sent to the mainland. Our labs have been stood up here so we can get the results back a lot quicker as we do the contact tracing. And we're trying to put in as many layers of protection as we can. But at this point, there is no guarantee. And we'll monitor our hospital beds. We'll monitor the rates of infection. And there are no specific dates. I know somebody had asked the governor at the press conference yesterday, when do you see us removing the 14-day quarantine period? And I go back to what Dr. Fauci has said on numerous occasions. We don't set the timeline. The virus sets the timeline. And so the most important thing you can do, if you don't need to be out, you should be at home. When you are out, use your mask. When you interact, make sure you wash your hands, have your cleaning materials. So as people have come through, if you're at work, to start cleaning. At the Senate, we've started putting stanchions in place, or we've started putting desks as barriers to door entrances so that you don't have people invading that personal space of the receptionist, and that we can get social distancing in place. We've removed chairs from the conference rooms, both for the members as well as for the public, so that anybody in a room, the social distancing is set up. We have tape on the floor, and as you go to restaurants, supermarket, I know Safeway on Baratania, they have one way on this lane and one way the other way, because they don't feel the lane is wide enough to have that cross traffic. And we need to continue to just execute best practices as more visitors start to come. And we need to get people back to work. There is mental health issues. There is concern about domestic violence, as people have been, staying at home, and financial pressure mounts, and other stresses that have come into play. So there are a lot of different other illnesses and stresses that are a result of not being able to get back to work as well. It's not just limited to COVID-19 or the coronavirus.
Yeah, definitely. And I want to make sure that we have some time to get to those issues. There's a lot of questions coming in specific to, again, this travel lifting and some of the logistics. But in the sake of time, I'm going to try to pivot this conversation and I remind people that we'll be talking to Lieutenant Governor Josh Green tomorrow as well. So we'll get some of these questions that are coming in. Like Vicky and Todd have some great questions, but I just kind of want to move on, because directly to speak about the legislature right now, regarding some of the efforts that are being made. Obviously, there has been some debate over what to do with the federal dollars that are coming in and that need to be used this year. In the last sort of session that the legislator got together, there was the decision to put some of that money into the rainy day fund. Can you explain a little bit more about the process right now, about using some of those federal funds and being able to make those decisions about what and gets funded and how that is going to work when a lot of people are calling for support right now?
Sure. And, while directly city and county got, $370 million and immediately started doing food programs, small business grants. They stood up the Economic Recovery Office. They got PPP and a variety of things. On the first session we got almost 170 million to the 3 neighbor island counties. I can speak a lot more specifically to Kauai. They had money set aside for small business loans and grants. They had over $2 million for mental health services to nonprofits, as well as domestic violence, over $2 million for feeding programs. Most of those are all in matching. And so we saw the counties as a conduit to immediately deploy funds. And it gave us an opportunity to really take an assessment of where the needs were going to be past July 31st. So while there was a lot of criticism that said it's raining now, we had $13 million from that resilience fund with Hawaii Community Foundation, which had been deployed. A lot of other nonprofits or philanthropic organizations, the banks had all stepped forward to assist. Now that we've had a time to take that assessment, we're going to plus up unemployment by $100 a week. We don't have enough funds to get to 600, but we believe unemployment will need assistance. From August 1st to December 30th, we have a rental assistance program. We know that that's a big issue, having enough money to pay the rent, because we're a more expensive place to live. So either half the rent or $500 a month, again, through December 30th, whatever is less. So we'll have assistance for renters. We've got an investment into D-bed. We've got feeding programs. So there are a host of areas that we're putting the money into. We had in the first session help upgrade the IT for our Human Services Department. They had an increase by 18,000 for SNAP, or what we used to refer to as food stamps. They are now, I believe, giving out $13 million worth of the SNAP program every month. And so we have really stepped up in that area. And then we've been partnering with the counties. And on Kauai County, they're going to spend $1.5 million to get more public free Wi-Fi access, as well as upgrade the digital platform. One of the areas that we have been concerned is we've not been able to get data from the Department of Education on what the specific needs are, and the surveys have only recently gone out. Having been on some of these committees with the broadband WUI and communications, this became apparent to me. And a couple of months ago, I got together with the three Kauai representatives, Tokioka, Nakamura, Morikawa. I'll talk to Complex Area Superintendent Arakaki, who's retiring at the end of this month, and his successor, Paul Zena. And in 7 days, they did a quick back-of-the-envelope survey. We've had some volunteers from Oahu that took the data and put it into different formats, and it's allowed us to reach out to the principals. They've come up with a plan, and part of moving quickly is we had the $1 million donation from the Chan Zuckerberg Foundation, and we needed to put together a proposal to get their help. Well, I'm glad to report today they've given us $150,000. First Hawaiian Bank, Bank of Hawaii, $100,000. First Hawaiian Bank, $25,000. Hawaii Community Foundation put up the first $100,000 to match, to get to $400 to get the program underway. The Atherton Foundation gave $50,000, and we had $25,000 from Honua Ola. And then my wife and I personally donated $15,000 to this program. There have been a lot of people that said, how are you reducing your pay? $15,000 happens to be about 20% of my salary. And so I've committed that to the children of Kauai. And it's our intention, we hope, to set up a program that can be replicated and taken out to the rest of the state. The first thing we're going to do is teach teachers to be better distance teachers. We've contracted with Chaminade's Department of Education to make that happen. We're going to buy additional hotspots besides the ones that we're going to be allocated for the summer program by the DOE, and to get additional devices. 8% of the students did not have Wi-Fi connectivity, and only 33% of the students were engaged in distance learning in the fourth quarter for the Kauai complex, based on the data that we've got. So while we talk about, the unemployment, the rent, making sure people can eat, we're incredibly concerned about what we can do to help the students, succeed in what is now a new learning environment. And in the money we're deploying, we're also matching the Hawaii Community Foundation money for students who graduated in 2020. If they need some kind of counseling, training, or other kind of help so that they can get to college or get to trade school, we really want to make sure that they do not get left behind because of what happened in their fourth quarter.
We also want to ask you about the public worker pay raises that have been making headlines. This package that is being advanced now by House and Senate leaders, talking about $150 million in general funds to cover those pay increases. What's your thoughts on that?
My thoughts are, it looks like our time is up. It was really good being here. It's a really tough situation there. We represent about half of our government employees. The other half had contracts that were negotiated, passed, and signed, and these missed getting approved last year. In our session, they were routinely brought up in the next session this past January. And do we have one class of employee and a different class, and they're not treated the same way, and that's really the rub of fairness to employees. And unfortunately, I shouldn't say unfortunately, factually, a lot of these employees are police dispatchers, nurses, and employees who have been on the front line and have been essential workers and have been coming through or coming to work every single day during the COVID-19 crisis. And then you come up against a budget crunch, and what are you going to do? And the one thing I learned early on when I first started, there are no 2 + 2 = 4 answers in this business. There are a lot of correct answers, and you need to make a choice as to which correct answer do you think is the appropriate way to go. We are continuing to get some information, but the vote is coming up shortly, and we'll all have to be accountable for the choice we make.
Is there any way, I mean, you've got to look at, of course, every industry and every union and every contract that comes up, and obviously theirs is up this year, but you look ahead, there's going to be more contracts that are going to be on the table, more people that are going to be seeking raises, and I think right now they're, from the responses that we've been getting and questions that we've been getting specifically about this topic, I think that there's just a lot of people who are just frustrated that, they're just making, they're having struggle making ends meet. And yet there's another group of people that are now calling for raises. Is there any way to maybe table those sorts of discussions for the next year? I mean, how do you maybe communicate, I guess, to those people who are saying, hey, I can even get unemployment to answer my question. How are these guys?
But there'll be some tough choices that'll have to be made. One hope is that they do deserve a contract. Everybody deserves to be treated fairly. And when it comes to July 1st, everyone will collectively realize that raises aren't appropriate. But that's part of the bargaining process, and the governor and the unions would need to get together to come to some kind of agreement. The other thing that winds up happening, if the money is short, the governor has already indicated one of the last resort options will be furloughs. And so even if they wind up with the raises to balance the budget, one of the options may be, we may be forced to have that reduction. And so, at the end of the day, they would wind up where they would be earning less than they are today. The other thing is, can we reimagine government? Are there certain functions maybe that they were in the category of when we were economically doing well? This was a good thing for us to be doing. Now that we are in a different financial situation, should it be eliminated and employees would be redeployed, and the cost of government as far as the day-to-day salaries may be reduced? These are all hard choices that we're going to have to make. And at least as legislators, we can say that, we've already deferred any potential pay raise that we were scheduled to get like them until after July 1st of next year, which allows us to go into session next year and evaluate where we are. The governor and all of the cabinet members have deferred their July 1st pay raise, and all of the judges have deferred their July 1st pay raise. So the first thing we need to do is lead by example by, not getting raises for ourselves. Certainly the second thing I've done is said I'm willing to donate 20% of my salary to the effort to help the students on Kauai. So I've already taken a pay cut myself in acknowledging this, but at least it allows me to, look anybody in the eye and answer as to what have you done. I can say what I've done and what I'm willing to do as far as the sacrifice. But in the crisis, there are no easy choices. There are difficult decisions, and then there's harder decisions.
Yeah, absolutely. And, I'm that effort that you're talking about, bringing those kind of digital resources to, the children on your island is going to be so critical. So I'm sure there are so many thankful families for that. I know we are out of time, so what you said is true. But before we go, we'd just like to have any final thoughts from you as you head into session and you negotiate these tough things. What would you say to the public right now? I know a lot of people are kind of having COVID fatigue. They're, in essence, people feel like they're over it. But as you said, the virus dictates the timeline, and we are far from over this hill.
Well, we've been working hard. It is funny that people say, well, since the legislature's been in recess, you're doing nothing. And I can tell you the amount of Zoom meetings and other interactions, answering emails, following up on constituent concerns. All of us have been diligently trying to serve our communities. We hope that we've got answers that work out. And most importantly, hopefully the HEROES bill will pass. There will be some additional funds to help shore up the state budget a little later this year that will relieve us from making some of the difficult decisions we're forced to make today. But again, the best thing you can do is practice the social distancing. Wear your mask when you're outside, wash your hands. If we all do our best practices, we'll all, hopefully come out on the other end. But it's only with our cooperation. And I'm just so impressed with the people of Hawaii. We've had very little of, the lack of cooperation. And again, even my mom had complained about the mask and being hot and everything. But I told her the mask is respecting the other person. The mask is not protecting you. It's protecting other people from you. And really, what do you want to say to your neighbor? You want to tell your neighbor, I respect you, I love you, and, we both want to get through this healthy. And so that would be what I want to say. And for my wife, Joy, out there, you can see Yanji is back on Oahu, not the doors that caught her attention at her mom's house. And I'll fill you in on the story after I get off the air, Joy.
That's right. We are unfortunately out of time, but I do want to just give you a really quick opportunity, just quickly, to just maybe say a few words about your colleague, Senator Breen Harimoto, who actually lost his battle with cancer. You've worked with him. I worked in the Senate. I had the opportunity to work alongside of him as well. Just some closing thoughts that you may have about the senator and his contributions.
No, he was, a very quiet, humble individual. He was very slight of build even before his battle with cancer. With the pancreatic cancer diagnosis, usually it's 6 months or less as far as your life expectancy. And the fact that he went, and carried out his duties for an additional 5 years showed his strength, his courage, his conviction. And I have said a few times from the rostrum of the Senate floor that he is one of the strongest persons that I've ever met, and tremendous role model about how to live your life with dignity, class, respect. And a lot of us aspire, hopefully, when our time comes, that we can face, the end with the same kind of dignity and class that Senator Harimoto did. Our hearts go out to his family, and we are working with his wife to see about having some kind of ceremony on the Senate floor to more formally honor him. Unfortunately, it can't be like the ceremony we had for your father or Senator Gil Kahele, where we can open it to the public, but we certainly want to honor his service, and not just as a state senator, but a county, city and county council member and a member of the Board of Education. He has served our community, our state, well, and he will be missed.
Thank you, Senate President Ron Kouchi, for those words, and also just for your time here this morning and updating our viewers here on the platform of the Honolulu Star-Advertiser. We look forward to hearing more from you, and we'll continue to watch what happens here in this legislative session. Thanks for joining us.
Thank you.
Aloha.
Thank you. So good to hear from him, and thank you for asking that question. It was so beautiful to hear his words about the late senator, and so we really appreciate that.
Yeah, definitely. And again, a lot of information being presented. There were some great questions, again, that came out about the logistics of this travel ban lifting that is happening on August 1st. And I think a lot of people posed a lot of great questions. Unfortunately, we couldn't get to all of them, but there were so many great questions. We're going to try to take some of these questions today and ask them to Lieutenant Governor tomorrow, because we know that he has been actively involved in this process of planning this opening. I saw some great questions about how do we distinguish those visitors that come in with a testing and some people that are cleared, as opposed to those who decide they're going to do the 14-day quarantine in a hotel. How do you distinguish between those two groups of people? A great question. Again, a lot of logistics happening, especially for local residents that maybe want to get away for a few days and come back. When do they get the testing? How does it get managed here in Hawaii? So we look forward to those types of questions. I think tomorrow will be a deep dive into more of this ruling that came about and the logistics that are all behind that.
Yeah, and I saw a good question there also about minors. At what age is the cutoff for testing? Are you going to make young children get these tests as well? So we will ask all of that to Lieutenant Governor Josh Green tomorrow. Turning now to some of the other headlines in the paper, struggling restaurants are asking the city for help. The restaurant industry has painted a pretty bleak picture. You heard here from Chef Leon Wong earlier in the week, who was saying that the sort of working number that everyone is working with right now is 20 to 30% of Hawaii restaurants not being able to survive these times. But she was saying that she fears that number could be, 70 to even 80% if we go through a true second wave and have another severe shutdown. So the restaurant industry, and these are small businesses, often just family run, that are asking for the city's help. So there's an interesting article about that in the paper today. Also, state health officials echoing what actually you had said at the top, Ryan, and then the senator had said, that Hawaii is prepared for a second wave when we're looking specifically at hospital readiness.
That's right. And, they're making a stark contrast with where we are now compared to where the state was earlier in terms of just their overall readiness, communication, as well as the infrastructure in terms of getting things set up. We heard from Lieutenant Governor Josh Green talking about the fact that, the state really didn't have to use some of their emergency operations that could have been implemented, such as, employing the National Guard to set up these hospitals should they need to be set up. They also credit, again, the contact tracers and the amount of money that's being allocated in the state budget to really help to fund the Department of Health in this area. And so there is a lot of different ways in which they've expanded the ICU units throughout the state. And so the state health officials feel very confident about where they are at right now. And thus maybe the reason why they have sort of decided to move forward with this lifting of the 14-day quarantine. Hawaii's talking about lifting it, but we're hearing from other states in the mainland that are now really implementing that. New York, one of those states that are now saying, if you're coming from Florida or Texas or some of those areas where they're seeing those surging numbers, you will have to undergo that 14-day quarantine. So the practice that was here in Hawaii now being modeled after by other states that are now worried about this interstate travel to their own areas and their own states.
Yeah, so we'll be talking again about all of this tomorrow with Lieutenant Governor Josh Green, and then Governor Ige joins us on Monday. Tuesday is our last day of this particular conversation, but fear not, we will be joining you the week that follows with a different format, and it'll just be Mondays and Wednesdays. That starts July 6th. Ryan and I will shift from purely talking about COVID to talking about issues throughout the community. And we'll be kicking off our series with 6 conversations with candidates that were decided by the editorial board of the Honolulu Star-Advertiser, the top 6 candidates that they've identified for Honolulu mayor. So we're really looking forward to those deep dives. We'll be spending a half an hour with each of those top 6.
That's right. So we, again, want to encourage all of you to continue to tune in. We have sort of set out on this COVID-19 care conversation as a way to kind of bring all of you information about what's happening with COVID-19. And it's by no means over. Of course, we are seeing these sort of phases happen. But for us, we're going to sort of shift the conversation and be able to provide you some more opportunities to question those lawmakers and those candidates, we should say, that could potentially be leading the city and county of Honolulu during this time as COVID-19 progresses on. So we look forward to that discussion and encourage all of you to continue to stay posted. Of course, we won't be here every day, but we'll still be here a few times a week to join you and bring you that information. One of the things that we've always enjoyed doing through the show, and we tried to make it a staple from the very beginning, was highlighting some of the good things in Hawaii. Oftentimes, it gets kind of bleak when you hear these numbers and you hear the headlines, but we also have to recognize there's some great things that are happening, and we love to do that through our Hawaii Hero segment.
Yeah, and today we are highlighting the Legal Aid Society of Hawaii. This is a tremendous resource for people if you have a dispute and you can't necessarily afford an attorney, or you just want to ask a legal question, figure out, a lot of people are facing eviction questions. They're also, if they've been separated from their job, or there's a number of issues that have come up through COVID. Of course, Legal Aid Society has been here for some time, but now they're doing a lot to help people through the coronavirus pandemic. So their numbers are right there on your screen. You can call them. They're not in person right now, but they've continued to operate throughout the pandemic, helping people get some free legal help, which is very needed right now.
That's right. And just another example of somebody who's stepping up and providing support in an area that, of course, they can provide. And again, that's that information. You can also visit their website for more information about how you can find support, because we do know that there are some people struggling with some questions, and it may not necessarily be a full, intensive, legal matter, but maybe they just need to get advice and opinions, and it's a great way to do that. So we thank you, of course, Legal Aid, as well as all of our Hawaii heroes who are making a difference in our community. Again, we want to thank all of you for tuning in, and thank our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for allowing us to have this conversation. We look forward to the conversation tomorrow with Lieutenant Governor Josh Green, where we will talk more, of course, about the COVID-19 travel ban and its lifting of Hawaii guests from out of the state, as well as other topics related to COVID-19 here in Hawaii. So until then, we will ask all of you to continue to stay safe and look out for each other. And we'll see you right back here tomorrow at 10:30. Aloha.
Aloha.